Thank you for choosing Axxess On Demand. Axxess believes in continuing education, and we create content to empower you to learn and grow anytime, anywhere. Let's get started.
Hello, my name is Cully, and I'm on the marketing team at Axxess. Axxess leads the industry with a complete suite of easy-to-use, innovative software, empowering home health, home care, and hospice organizations to grow business while improving patient care. Thanks for joining us for Reaching for 5 Stars, being competitive in a value-based world. Tammy will be our moderator. She oversees the professional services division at Axxess with a focus on practical technology solutions for the post-acute care industry. Prior to Axxess, Tammy served as an executive consultant at Fozzie & Associates, where she used her home health leadership experience to assist clients with clinical and operational strategic planning and development. She also oversaw operations for a multi-state home health provider and was instrumental in creating disease management programs that lowered the Medicare spend rate and improved 5-star ratings. In addition to her credentials as a certified case manager, Tammy is a registered nurse with a bachelor's degree in nursing. She holds a master's degree in healthcare administration from Columbia Southern University and has an advanced certification in healthcare case management and quality improvement. Our panelists are Dr. Andrew, DeAnn, and Darryl. Dr. Andrew is the Director of Patient Engagement and Clinical Education for Axxess. He's responsible for providing industry thought leadership and the strategic direction and delivery of Axxess CAHPS, a patient engagement solution aimed at improving clients' patient survey and quality ratings. Prior to Axxess, Dr. Andrew accumulated more than 25 years of experience designing, implementing, and evaluating aspects of electronic health records across various clinical settings. He's helped create and implement wellness and chronic disease programs in ambulatory and public health settings. Additionally, he possesses his doctorate in nursing and board certification in nursing informatics. DeAnn is coming to us from Mac Legacy, where she serves as the Senior Director of Clinical Education. She has worked in the home care industry for over 35 years. Her current responsibilities include agency training and the planning, implementation, and evaluation of continuing nursing education programs. Mac Legacy specializes in solving complex problems and turning them into simple solutions for home health and hospice organizations. They provide coding, expert consulting, education, and tools to help organizations compete in a difficult marketplace. Darryl is currently a registered nurse, and he has been a licensed nurse for over 30 years. He possesses experience in healthcare from behavioral health to cardiology and has always sought to improve staff productivity and patient satisfaction through best practices, innovation, and team building. Darryl serves as a Director of Nursing and Director of Operations for Elite Home Health, and he also works as a business development consultant for home care and assisted living facilities throughout Florida. Elite Home Health, started in 2014, has the Accreditation Commission for Healthcare Accreditation and is a Medicare certified agency that provides skilled nursing, home health aid, and therapy services for hundreds of patients at their locations in Boca Raton and Fort Lauderdale. Before we begin, a few housekeeping items. Your phones have been muted, but you may submit questions through the chat. We will also have 3 on-screen audience polls throughout the presentation, and we encourage your participation. Slides from today's presentation are in the handout section of GoToWebinar, and the webinar recording will be available in a follow-up email to all who registered. Welcome, Tammy, Dr. Andrew, DeAnn, and Darryl.
Thank you.
Thank you, Cully. It's great to be here. Let's start off with our objectives today. And Dr. Andrew will just advance that screen and look at what we're going to be studying about or spending the next hour talking about basically is reviewing first the survey process and its importance. We're going to understand the relationship between quality scores, patient experience, and patient and business development. And Darryl has a great story he's going to tell us about that and how that touches every aspect. And we're also going to hear how Elite Home Health increased their star surveying ratings by 2 stars. 1 year, 2 stars. That's almost unheard of. So I can't wait to hear what Darryl has to tell us. We're going to learn about some best practices. We have DeAnn from Mac Legacy. She certainly knows that best practices. Mac Legacy is known for implementing best practices in the agency. So DeAnn, looking forward to hearing from you as well. And of course, my colleague, Dr. Andrew, just very excited to be able to present this with you. He leads Axxess with our CAHPS surveys. And to have someone that has a degree in informatics, I feel like kind of the dumbest person on the line right now, but let's see if I can at least ask the questions right as we get going. We'll take the next slide and just a little bit of background. Why? Oh, we're going to do a poll first. Let's do that poll. What is your organization's most recent CHAP patient survey star rating on Home Health Compare? And we're going to give you a few minutes to do that. And while the audience is polling, DeAnn, can you tell me, while the audience is completing the poll, have you seen a shift in the way organizations are approaching patient engagement since PDGM and maybe since COVID?
Yes, well, I will say that the pandemic has changed everyone's practice. And then on the top of that, PDGM, it's been a lot for agencies to contend with. It's only natural when there are major changes like this that agencies, or, you know, no matter what area you're working in, that you're going to lose some focus as your personnel and leadership are stressed out from the pandemic in particular. And I was already concerned about agencies losing their focus just from PDGM. That whole change has been major for us. I mean, it's the most major change in reimbursement in years. And I was afraid that agencies might take their focus off of the reported quality measures as they just adjusted to the 30-day periods and how your case mix is calculated. But to answer your question, really from the beginning of care, the patient and the caregivers must see their care as a team effort with the home health or hospice team. And at each visit, I encourage clinicians to summarize the patient's progress and ask the patients how they're doing in the effort to meet their goals. And you'll hear me saying this quite a few times. I think that's one excellent way to push patient engagement in their own care. And we're talking about things that are just as simple as saying to the patient, one of our goals is effective pain management. You know, we'd like to get you stated at start of care that you would like to get to a 2 on the 0 to 10 pain scale for pain. And how do you feel like you're doing? And are you utilizing the strategies we talked about the last visit? Be a very careful listener to what is being said and analyze any negative comments. If the patient verbalizes they aren't utilizing suggested strategies, you have to figure out why. You have to be a little detective and what are those barriers. So the other major thing that has impacted patient engagement, in my opinion, has been the balance of infection control measures with patient engagement so that the patient doesn't feel alienated due to masks and shields and gloves and, you know, at least 6 feet of distance between you. I was just kind of laughing to myself and remembering when we all moved to electronic medical record systems and we were so worried about that tablet being an intrusive object between us and the patient. And now we have not only the tablet, but we have the mask and the face shields and, you know, maybe gowns on or whatever. So it's important to remind patients why you have all that on. You know, this PPE is protecting you, it's protecting me. We're going to get through this and help this COVID get under control.
Right. Right. Thanks, DeAnn. Those are some excellent tips and answers, and I think our audience would agree. We could see from our poll that we have about 9% of you that are already 5-star agencies on the phone.
Oh, wow.
So congratulations to the 5-star agencies. There's about 21% that don't know your star rating. I hope when we finish this conversation, our panelists will convince you, no matter where you work at in your organization, you need to know those star ratings. Let's go to the next slide and just take a look at kind of our summary and what we're doing. The reason we're on this call today, basically we're tying in patient engagement into not just patient outcomes, but also into our business growth as an organization. The rise of consumerism in healthcare means that patients and their families, they're expecting higher levels of coordination. People are tech savvy now. You know, I'm on vacation currently with my 76-year-old mother. She can operate her iPhone just as well as I can and loves all of her apps on it. So, you know, people we're caring for know how to use technology. They know how to check and see, you know, what are those star ratings and why would I want a 3-star versus a 5-star? So really looking at that amongst our providers and our staff is going to be super important. Dr. Andrew has done a ton of work, not just at Axxess, but prior to Axxess with CAHPS, patient engagement. And I know we have a video that we're actually going to drop the link into these slides. But Dr. Andrew, can you just briefly just kind of give us the background in case any of our audience on the phone, you know, don't really understand that process?
Sure. Thank you, Tammy, and I appreciate the comments that DeAnn made with the COVID pandemic. So we wanted to start out and, you know, just reminding ourselves that engaging patients does ultimately improve outcomes. And as we run through just some of the brief slides, just to serve as a primer for those who don't spend as much time with this, there are published studies that clearly indicate, we just provided 3 examples here, there are a lot more around how patient engagement and organizations engaging with their patients ultimately improve outcomes and also help organizations in a number of other ways. So the CAHPS family of surveys, CAHPS is an acronym for the Consumer Assessment of Healthcare Providers and Systems, has actually been around for quite a while. The Agency for Healthcare Research and Quality, AHRQ, partnered with CMS because CMS, we had showed you the slide around the quadruple aim, really how do we deliver the best care that's most affordable and efficient to the greatest number of people, and how do we also ensure that our teams are also taken care of, because we know if we take care of our people, our employees, they will take care of the patients that we see. So CMS realized that there was a need to really evaluate the experience that patients have with their healthcare organizations. And so the first surveys were rolled out in the hospital setting. And what we see is that in 2010, with the passage of the ACA, or the Affordable Care Act, that the idea of ensuring that we measure outcomes, especially the patient's perceptions of the care that they're receiving, were baked into what CMS was required to do. And so for home health, we saw that it was mandated starting April 1st of 2010, and in the case of hospice, that started January 1st of 2015. And I think most of us know that there's also the Care Compare measures that CMS publishes, and it's based on this goal of ensuring that we give, or CMS gives us as healthcare consumers, 360 view of how organizations are performing, so that we know how to select the organizations that we want to receive care from by selecting organizations that perform much better or have higher star ratings. So what's the goal of CAHPS? It's really, in the case of home health, it's evaluating or asking patients who received home care or home health care to evaluate their experience across the continuum of care with that particular home health organization. In the case of hospice, it's the caregivers of decedents. So after a patient has passed on, whoever they've designated as their primary contact, they're the ones that complete that survey. And again, the goal really is to monitor quality measures and the star ratings on the Care Compare website. And when you look at all the language around CAHPS, what you'll see is that CMS views it as a quality measure. And that's why they publish that to the Care Compare website. And the home health or hospice quality programs are based on the fact that organizations that are home health organizations have to submit both OASIS data, and in the case of hospice organization, the hospital information set, and they also have to participate in CAHPS once they meet the minimum. If they don't, then there's a penalty that impacts their annual payment update, the APU. So we don't have a lot of time. If not, there's a whole lot more that we could say about it, but look for the link if you've not already viewed that. And we go into a lot more detail and actually outline exactly what happens with both the home health and hospice CAHPS surveys.
Thank you, Dr. Andrew. And I encourage you again to access that link. There's a ton of information in a very short period of time on that video. So we've been hearing a lot about delayed reporting because of the pandemic, change in reporting with CAHPS, and just kind of organizations, I've heard different views of that. You know, some organizations are really drumming up and taking this time to really get themselves ready for that next reporting. And I think some organizations have kind of stepped back and said, well, that's one thing off of my plate. DeAnn, can you give us some advice in that area? What do you say? What should organizations be doing now?
Well, I completely agree. Let me be sure I'm off mute. I completely agree that you should use this time to perfect, to work on your strategy to improve your outcomes. October 2020 was the last time we received any current data reported on Care Compare. And this, of course, is to accommodate the changes in quality reporting for agencies, the decreased visits that you've had, the census that may have fallen during the pandemic, and just adjusting to the pandemic. So for all quarters, just to remind you, all quarters of 2021, you're going to see that same data that was reported on October 2020. So there's going to be no updates and no previews for you to worry about. But I am a full believer in keeping the pedal to the metal if you can, and using this time to improve anything that you look at your October scores, see where perhaps you're falling a little bit, and come up with some strategy. CMS, as far as I understand, has not announced how they're going to report the data that's received in this interim time, a little over a year, but I feel like they will let us know towards the end of the year. and usually kind of at the last minute. Whatever method they use to report your data, you want to be sure that you know your standards are still as high as they were. Don't take your eye off the ball.
Thank you, DeAnn. I think that's excellent advice. Dr. Andrew, anything to add?
You know, I like the points that DeAnn made, and I agree with those points. I think the only thing I would add is we know that due to the public health emergency last year, that there was a suspension in organizations being required to submit that data. But like you and DeAnn said, most organizations just continued doing their surveys, even though their census dropped. And I think it just shows that a number of organizations understood the importance of continuing to keep their foot on the pedal. And, you know, just like DeAnn mentioned, this is an opportunity to continue doing what we know we need to do, and to ensure that once CMS starts reporting January next year, we know that most of the reporting typically is lagged by anywhere from 6 to almost a year and a half long. So whatever we're doing now will still count towards 2022 when reporting resumes. So just to reiterate and emphasize that.
Thank you, Dr. Andrew. Well, now let's get to how someone got 2 stars in just 1 year. Darryl, this next slide has your name all over it. When you shared your story with me about patients' perception of healthcare and kind of how you had to start with that staff level, you know, I think sometimes there is a negative perception out there about healthcare, especially now with COVID. You know, Queen of Pain, you know, we're the nurse with the attitude, press that call button one more time. In our case, you know, don't call me or just show up for a visit without calling. Can you talk to us about some things that you did specifically with your staff to really, you know, buy in and change those star ratings and improve patient engagement?
Oh, gladly. Number one, we at Elite definitely believe in the team approach. So every aspect of Elite comes into play when we look at our patients, whether it's the sales team, whether it's the office, the administrators, and definitely our clinicians and resources. So we embarked on a journey of changing the culture, as it were, to making sure that our patients understand that they are the most important piece in this puzzle of home care. And we are here to help them along with their journey, not interrupt it, not come on our own time, not get there late, not give pain without some sort of way of mitigating that pain. So our clinicians then, we had training sessions with them just to be sure they understand that our patients are the most important thing, and not our time. And even though CMS makes it very clear that everything has to be done it's patient-driven, not doctor-driven, and not agency-driven. So we took that to heart, and we used the lag time during the pandemic to make sure that we started putting all those things in place. Yes, there was a minor decrease in the census, but that helped us get other things done. Like DeAnn was saying, and Dr. A was saying, that don't use that time just to sit around. No, you use that time to try to get ahead of the game. And that's what we did. Our clinicians, our office staff, our sales staff, everyone jumped on and said, okay, now this is coming, especially with PDGM and everything else. It was like, what can we do now? So we immediately started training everyone, whether it was the clinicians, office staff, or our sales staff, and even educating our physicians that we work closely with. So that particular way of just making sure everybody understands, our owners have a way of saying over communicate, and that's what we did.
That's excellent, Darryl. And one thing that you had said to me that just really resonated when we spoke a couple of weeks ago was happy employees, happy patients. So I think that comes out in
Yes.
everything that we do, right? If your staff is satisfied and happy to start with it, it carries over. All right, and this next
Absolutely.
slide.
We have to take care of our staff.
Yeah, exactly, Darryl. And I love the way you include the office staff as well, because it starts in the office as well with that phone call. As we look at the next slide, and you've already touched on it a little bit, we know that patient experience is really key to success. You had a downturn in census, and you shared that, but within that whole total little over a year, you also really grew your census. Can you talk to us a little bit about that and what led to growing that census?
Again, with the team approach, we have an excellent sales team. And with the communication and education that we focused on, everybody understood. There was no enmity between the sales team and the clinical team, like I'm sure a lot of these agencies could understand. Everybody had a singular focus, and that was to help grow the agency and be the best at what we do. Our owners like to say we were the boutique of healthcare, as it were. So, and keeping with that thought, because our census had dropped a little during the pandemic, it enabled us to actually make visits to some of our patients, our clients, to be sure that they were happy and let them know that we haven't forgotten about them and we were there for them. We actually even started doing some swabbing and stuff for our patients in their homes so they wouldn't have to leave. We started even taking care of our staff in the same way, doing swabbings for them. So, like I said, there's a whole team approach in that we look at every aspect of it. And again, like you said, if we have happy happy staff, we're going to have happy clients. And we make our clients feel like they are VIPs because they are.
Excellent, Darryl. I'm wondering if, DeAnn, if you could also speak to the fact, do you think there's an opportunity for organizations to actually market their star ratings with referral sources? And have you seen that being done? You know, if you have those high star ratings?
By all means, if you got the high star ratings, you should publish it, put it in the paper, share it with your referral sources. And I love what Darryl said in the fact of how he did it. And I think that when you're talking to the referral sources, not just say, you know, we're a 5-star agency, but you need to tell them how you did it, that we value our staff. We only hire the best staff. And the patient is number one. And you just brag on yourself. The other thing I wanted to say was I have had experience with agencies who, particularly when the star rating started, they hadn't been working for their quality scores prior to that. And so they started with low scores. And it wasn't that they were a bad agency. It was just that, you know, maybe their OASIS assessments weren't very accurate. They were discharging without a visit, so it didn't show any improvement in their outcomes, things like that. So these agencies, if you fall into one of these, or let's just say you have a 3-star, which is great, but if you have 3-star and your goal is to be 5-star, take your current status, your current self-calculated scores, and tell your referral sources. You know, we've had a problem with our ambulation, improvement on ambulation, but this is what we've done to improve over the years. And as you know, there's a lag in reporting. And so This is our current calculation of our patient outcomes on this one outcome.
Can I speak to that as well?
Yeah, please, Darryl.
One of the challenges that we faced was our patient population. A lot of them were in ALFs, or they were really debilitated. So that affected the surveys coming back. So we had that challenge, as well as just letting the patients understand when they get these surveys what they're about. So what we did was we talked to our patients constantly throughout the episode, just finding out how we're doing, how they're feeling. So then when the survey comes, then they understand that this is just a continuation of that checking and making sure they're okay, because a lot of patients would just throw it away. And like I said, our patient population wasn't always the most astute, or they were very debilitated, so that affected our surveys going back. But with time and with that consistent checking, just seeing how you're doing, coming by to see them, our managers even going out to see them sometimes, our directors of sales, at times even our owners went out to see some of our patients. Not only when there was a problem, but just to let them know that we're there for them and we care. And you'd be surprised just what 1 or 2 visits will do when it comes to the overall star rating, because word of mouth travels very fast, especially in an ALF or in a small community.
Darryl, that's excellent. And you brought up something that I was thinking about. Your return rate on surveys is very important, because the lower the return rate, the lower the potential for scores, right? Dr. Andrew, you calculate or at least have the ability to see a ton of data coming in through Axxess on a daily basis. Can you talk to us a little bit about that analytic piece of it? How important is that return rate? And are there things that owners, administrators should be looking for as they start analyzing their data that comes in?
Absolutely, and I suspect some of our some of those on the webinar are doing that already. I really appreciate the point that Darryl mentioned, and it's one of the areas that we work with our organizations to really get those response rates. Because even if you send out surveys to 50 patients and you only have 5 or 4 respond to the survey, that's not very encouraging. And the goal is to increase the number of responses you have. And so part of what we've worked on very early on is just providing tools to organizations to help them understand that it's a partnership. The piece that they can work on is communicating, like Darryl said, with their patients to help them understand that as part of the service that we're providing to you, we're contracting with a third-party vendor to evaluate how well we're doing. They're not our employees, so that it's unbiased, and we take that feedback and we talk about it, whether it's on a monthly basis or on a daily basis, and we use that to continue to provide care to you. The data, the organizations that we've seen that have performed extremely well are organizations that have followed the CMS guidelines, typically when they're initiating care, and if they happen to be doing a research and just educating their patients about the fact that they will be surveyed and giving them some of the collateral that they'll be receiving, whether it's a mail survey or letting them know that if you hear from an organization called Axxess, this is why they're reaching out to you. They're not trying to sell you anything. They really want to hear your opinion. I think once organizations start receiving that data, part of it is obviously to look for areas where, as an organization, you might not be performing as well as you've anticipated. And if you happen to have a QAPI project going on, a quality assurance performance improvement project, that happens perfect time to actually begin to look at that data. And obviously, there's some areas that are much more difficult to impact and are multifactorial, like rehospitalization, where there's really not a question per se, and that measure happens to be, looking at claims data. But I think similar to what Darryl and DeAnn have mentioned, really working with your staff and helping them understand that the patients that we're taking care of are our business, and we need to treat them like we would any one of our family members. We know that some of those patients might be challenging, and continuing to find ways to engage those patients in a way that's unique to them. So I would say definitely work with your survey vendor, ensuring that you're getting close to as real-time data as possible, and then really going through that data, identifying areas where you expect to be performing better, and then putting in interventions. So doing a performance improvement project where you begin to really look at that data in real time, and maybe just doing welfare calls or doing surveys that don't use the exact same question as a CAHPS survey questions, but that still help you get to that information so that you can gain insights into whether you're really moving the needle in a number of those areas and really driving the quality of care that's being provided.
Thank you, Dr. Andrew. I could spend the rest of the time right here. This is great conversation. But let's move on to our next slide, and I believe it's going to be another poll, just so we can kind of get the sense of our audience. If you could jump in and answer this poll question: does your organization's clinical team have a process in place to regularly set goals for and review quality measures? And while you're completing that, Darryl, I'd like to hear about your organization. Did you have something like that in place?
Yes, we did. At the beginning of the year, we all set our benchmarks on goals we want to reach, and we shared that throughout the team. But it's not set in stone. Of course, we started meeting weekly at first, just to get everybody's feet wet in the process and how we wanted to change things. And as it continued to improve, then it would go to monthly and then quarterly. But yes, those benchmarks, they're liquid because sometimes we think we want to improve ABC, and then when we take a really good look at our agency, we might really need to work on EDF. So, So that's how we did it. We just started out with benchmarks at the beginning of the year and then changed them as time went on, if necessary.
I like that, Darryl. Let's see what our audience said as we get the results of this poll. Okay, I'm not seeing the results here. We'll go ahead and move on, and we'll be able to show you that later. And just go on to that next slide because we have so much more to talk about. There we are. Could be a delay on my side, and I apologize. So 80% of our audience did say yes on that question, so that's great. It sounds like we're already one step ahead of getting those 5-star ratings. We have to measure it. If you don't measure it, you can't really reach it. You have to know what the bar is. As we go back to the next slide, Darryl, you mentioned something to me when we were discussing earlier, and actually you mentioned it on this call as well. You talked about education and really needing to educate your staff. Can you tell me a little bit about that and relate that to the 4 areas that are generally impacted by patient engagement, like patient safety, staff satisfaction, outcomes, and your revenues?
Okay, the number one, like you said, like you have there with patient safety, because our clinicians are very good, They didn't need to be reminded often about safety. But then the pandemic happened, so then we had to look at patient safety in a different way. A lot of times they needed to feel safe from us, that we weren't actually bringing them an infection. So we let our patients know that our staff uh, has been, or they, well, back then, they were tested frequently and they were safe to come in their homes. Now, when you talk about the staff efficiency and satisfaction, um, we have frequent education sessions with staff, whether it be the clinical staff, the office staff, and we even included our sales team on education and satisfaction. Our sales team oftentimes speaks to our patients just to be sure that they're happy and that they're getting their needs met as well. And with patient outcomes, our QA team, we look at, like I said, those benchmarks and see how we're progressing towards them. And if there are barriers, then we have to understand what those barriers are, because those barriers may be ourselves. And we remove those barriers to increase patient outcomes, whether it be in the documentation that our clinicians are late on or not documenting the good that they're doing with the patients. But whatever those barriers are, we have to overcome them. And like number 4, the bottom line with revenues, all this leads to revenue increase or decrease. So if our patients are satisfied by word of mouth, they will tell other patients, they will tell their doctor will increase the amount of referrals that come in. It makes our marketing team have less work to do because they're not having to overcome bad reviews. We have staff that really want to work with us because then the staff are treated fairly, and that also spills over again onto patient satisfaction. So, and with PDGM, if all of those things are coming together, it helps our revenue. Unfortunately for us, we did not have a large decrease in revenue because we were, how would you say, gaming up for those things because we saw it coming. So we didn't wait for it to hit us all at one time. We started practicing and getting things ready, like DeAnn was said, in October. So when it really hit some of the other things, we were ready. Not to say that we didn't have some slide, but not as much as other agencies.
Yeah. And Darryl, we talked a little bit about what role technology played in that. Can you tell me what you did about technology? You had mentioned some of the staff wasn't as educated in some of the areas that they needed to be.
Exactly. So with Axxess, there's a lot of tools in Axxess that weren't being utilized. And even though Axxess is user-friendly, some of our users just was not using it to the best. So we educated them on the different aspects that Axxess brings. And we also educated our staff on other areas that we brought in to increase our revenue and increase what we're seeing with our patients and scrubbers, whether it's Axxess scrubber or an SHP scrubber, and just finding out where we're falling short. So then it helps our clinicians focus on those areas, whether it's filling out the OASIS or their documentation in their notes, because that ultimately affects our revenue and it affects patient outcomes and their satisfaction. So we made sure we paid attention to the electronic use of these particular tools.
Well, Darryl, you're going to be very pleased. Dr. Andrew and I have been working on a project for almost about a year now. It's an Axxess certification product where we'll actually provide education on technology plus the industry. And we're going to do that in short little modules on point of care. So I think you're not the only one that has experienced that. I think technology is only as good as the user, the way they know how to use that technology. And certainly, my 9-year-old granddaughter can outuse an iPhone from me, right? So I think sometimes age affects that as well. But as soon as we get that Axxess certification ready for clients, Darryl, you'll be one of the first organizations that we offer that to.
Wonderful.
Awesome. DeAnn, anything to add on that? patient safety, staff efficiency, outcomes, or bottom line revenue?
The only thing I would add, those were great. I agree with everything Darryl said. I do believe that you have to, as an agency, make a concerted, organized effort to encourage excellent care. It will not just happen. I mean, unfortunately, it's human nature to fall to the lowest, sometimes the laziest degree of functioning. And so you have to, from the top down, expect that you're going to have, excellence. And I loved how you did that, Darryl. The other thing I was going to suggest on bottom line revenues in regard to PDGM in particular is I've been in home care so long that I was in home care when you got paid by the visit. Those were the glory years, and probably wrecked the Medicare system. Then they moved to what they called IPPS. And at that time, it was in some ways like PDGM. It was like using a checkbook. You were given a certain amount of money. So we know that PDGM, every 30 days, you're going to get a certain amount of money. And I believe that the most financially successful agencies are involving their staff in that budget of care. Now, will you take some hits on patients? Yes. Some are going to cost you way more than you're getting paid. But I've also seen agencies fall into traps of just, it doesn't matter what the diagnosis is, they do the same frequency. Skilled nursing, in this case, 1 week 4. And maybe the patient doesn't really need skilled nursing. Maybe that money needs to be used on therapy. I just want to warn people not to allow yourself to fall into those patterns that you've always done, because you will go financially broke.
Absolutely.
Thank you, DeAnn. That's exactly. And we all are in it for the patients, but you have to make a profit as well. As we go to the next slide, we really want to talk a little bit about communication and about, that being a key to patient satisfaction. Darryl had shared with me something that he did in addition to really having his staff maximize what's available in Axxess Solutions. He used a piece of our solution called Axxess Care, and that's our staffing solution, because what we were finding is, if you're short of staff, you're not able to meet that next visit like you needed to, right? Maybe you told that patient you were coming on Thursday, but you don't have enough staff. So Darryl, can you talk to us a little bit about your experience with Axxess Care?
Yes, because our clinical managers, our clinical team, they're very astute when it comes to navigating through Axxess, much more than myself. So, and they were aware of Axxess Care long before I was. And we started using it, especially, like you said, in areas where we had difficult time staffing patients, and not to lose the patient or have the patient fall into some sort of unsafe category because they're missing a couple of visits. We used Axxess Care and it worked fine. It helped us continue with the coordination of care for that patient and not losing anything. And the patient, every time we used Axxess Care, was happy with the clinician that came. So one hand washes the other. It helped us out as well because it helped us with our patient satisfaction as well.
That's excellent, Darryl. And the study that we have popped up here actually shows that 8 out of 10 family caregivers would choose one hospice over the other if they had higher ratings. So that's on hospice organizations. And also if they have that communication which relates to coordination of care. Dr. Andrew, anything to add on that, the importance of that care coordination and communication with families and patients?
Sure. I think we all know that where there's lack of communication, people start imagining things. And so it's always good to ensure that as leaders that we make clear the vision of the organization, not only in the things that we say, but like we've mentioned, by investing in our employees or members of the team. And I like the example that Darryl gave where it was clear that if leadership was going to do home visits with patients, that was the expectation. And they weren't just going there and most likely chatting. It was to hear what patients had to say and ensure that they were communicating what it was that the organization was doing, and then really getting feedback from patients regarding the quality of care that they were receiving. We know there are a number of questions on the CAHPS surveys, both for home health and hospice, really asking patients about how well the organization either communicated safety or, assessed safety, taught them about their medications, listened to any concerns that they had. And so when we think about the questions that end up really being more of a net promoter score, which is, would you recommend this organization or this agency to family or friends? It's really a constellation of all the questions, really looking at what their experience has been. So it's crucial for us to communicate with our staff and help them understand what the vision is and how we're going about accomplishing that vision, because they're the ones that are really interacting with patients, and they can help communicate to patients what the organization is doing, and at the same time listening. And it's not just the clinical staff, obviously. We want to involve everyone in the organization, including the administrative staff, because if patients call and have concerns or they're trying to reach their clinician or can't reach their clinician, they're going to be speaking at someone in the organization who can impact their overall experience and ensure that they receive the information that they need. So you touched on care coordination. We know that's one of the major issues in healthcare is fragmentation in care, the lack of communication. That's really what fragmentation in care means, is we didn't hand off. How many of us have gone to different providers and felt like we just needed to record our last conversation so that we could play it for the new person because we felt like they should have been aware of what was going on with us? And if we think about our patients being in the same position, I think it will help us with really working towards improving our communication. Then the last thing I was really going to say is around the issue of staffing. We know there have been a number of different surveys that have been done by Axxess, by our state and national associations, really around the challenges of staffing. And we know that that's not going to go away. And we know technology absolutely plays a role in that. In the case of Axxess, we have Axxess Care. Regardless of who your vendor is, chances are they're working on something that you can use to improve communication, both with staff and with your patients.
Excellent, Dr. Andrew. I think our next slide is possibly another audience poll. Let's go to that slide and we'll see there. It talks about, does your organization share their quality measures with referral sources? We'd like to see what you're doing out there, and we'll just give you a few minutes to do that. And while you're doing that, again, as DeAnn said, encourage everybody out there. If you are that agency that has improved your scores, share those scores. Let's take a look at that polling result. And Dr. Andrew, while we're looking at those, can you also share with us among Axxess inside of our solution? I call it my favorite feature inside the solution. There's market data there where you can compare. Can you talk to us a little bit about that and why Axxess is a bit different than maybe other vendors out there?
Sure. You know, I appreciate that question because I think everything that we've talked about today is part of what we have ensured that we've built in, which is the best practices across the industry, and just listening to our clients as well. So we talked about the onboarding process, making sure that we're authorized as a vendor, making sure that organizations understand what our role is with the CAHPS surveys versus their role. They can't do the data collection any more than we can truly communicate with their clients or their patients about the importance of really hearing from their patients. And once they've done their job, our job becomes a lot easier. Into our solution, as you alluded, we've not only built in the surveying pieces, making sure that those responses are rolled up into the same reporting categories that CMS uses, but then also providing insights into what is being publicly reported, and then taking that information and making it much easier for organizations to identify referral sources, identify what other health or hospice organizations that are in their area are doing so that they can better position themselves, and then identifying referral sources like hospitals and really looking to, as we talked about, go to them with a story of what your organization's doing. And even if your numbers are not stellar, maybe you're 3 or 3.5 stars, but being able to speak to what it is you're doing to improve your processes and showing them that interim data, you know, so it's important to work with your survey vendors or any other solutions out there to tell your story. Use that real-time data to help fill in the gap. And that's part of what we continue to do with our customers. And we encourage you, if you're not, even if you're not on our platform, to use the tools that you have at your disposal.
Thank you, Dr. Andrew. And as we run up against the hour now, and we have about 2 minutes left, I want to just give DeAnn the final kind of question here about future trends and patient engagement. What can we look forward to out there? What do you see coming on the horizon?
Well, quality will always be an issue with CMS. We've seen that's a huge trend with them. I don't know. I've had some experts say that reimbursement based on value-based care and outcomes will never happen. But then you've got other experts who say it will. And so who knows? But it's a good decision not to ignore it. As Darryl proved with his agency's improvement in their star rating, quality, you know, everybody's looking for quality. And whether CMS rewards you for excellence in quality or not, those agencies who have the best customer service and quality of care are going to be the most successful and survive PDGM and pandemics.
Thank you, DeAnn. And I want to just say thank you to all of our panelists, DeAnn from Mac Legacy, Dr. Andrew from Axxess, and Darryl. Definitely the star of the day. Thank you for sharing your wisdom with us. And I will turn this back over to Kali.
Thanks, Tammy. Thank you all for sharing your expertise and wisdom with us. Don't forget, we will email everyone a link to the slides and the video recording. For more resources, visit us at axxess.com or contact us to learn more about our solutions. So, if you're interested in learning more about our patient engagement or Axxess care solution that we mentioned today, definitely visit us at axxess.com. By the way, if you haven't checked out the Axxess user community, I encourage you to visit community.axxess.com. It's a great place for Axxess users to connect, share information, learn, and grow. You'll get the latest updates and be able to see more Axxess webinars like this one that are coming up posted there. We would also appreciate your feedback on today's webinar. Please complete our short survey that will show on your screen in just a moment. And I want to leave us there and just say goodbye, everyone, and have a great rest of your day. Thank you.
Thank you.
Thank you.
Bye.
Bye. Have a great day.
Thank you.
Thank you for joining our on-demand training today. Axxess is the only home healthcare technology company approved by the American Nurses Credentialing Center to offer continuing education credits and the most recommended home health software on Software Advice. You can watch more on-demand training videos through our industry-leading help center or at axxess.com, where you'll find tutorials, blogs, white papers, and answers to frequently asked questions. Axxess, empowering care anytime, anywhere.